Good evening, everyone. This time I will ask for your attention. Good evening. My name is Michael Schwartz. I'm the Executive Director of Oral Health Partnership, and Oral Health Partnership is your host this evening. I am thrilled so many people are here, and so many great people are here to consider this important issue. So feel proud that you are in the room and helping to consider all this. I would like you all to know that this event will be recorded and shared, so we'll have it up on our website fairly soon. So we have some special guests to welcome, and I'd like to start where all of this work absolutely happens. And so if you are a dental assistant, hygienist, or dentist, or if you work in dental, please stand and be recognized. I like to say at OHP, we put our hands in kids' mouths. So, I'd also like to recognize some of our nonprofit, government, and public health partners. So if you're working at a university, a school, maybe your teacher or admin, or as part of a nonprofit, public health, also please stand up and be recognized. Of course, we couldn't do any of this work, and they may have already stood, but I'm going to make them stand again, with our amazing team at the Oral Health Partnership. And a bunch of you took the time to come in this evening when we also had a presentation this morning during our hour-and-a-half team meeting. So please stand, if you would, OHP team members, and wave and be recognized. Board members to stand. So the Oral Health Partnership board members who support us in all of this work, thank you. Getting through a lot of the thank yous, I promise we're almost there. We have a special committee that made this event happen, and these people were so important. So please stand up as I call your name. Mary Rasmussen, Dave Bertrand, Erica Plaza, Tony Bush McBride, Aaron Bongers, and of course, the person who did more than anyone else and got here at 5:15 and hasn't eaten yet, Julie Pavla, all the way in the back. Great job. Julie is our Development and Community Engagement Director, so you all know. I want you to be familiar with Julie and the great work she does. So that committee met multiple times to put this together. There are two other committee members that I wanted to recognize tonight who came to the majority of the meetings, and they are Madison and Sonoma. They were in our office running around keeping our spirits up. So it has given us just tremendous in-kind to be here tonight with you. Anthem, Blue Shield, Blue Cross. Hopefully some of you heard on Wisconsin Public Radio our advertisements going. They gave us in-kind to announce this event as well. I'd also like to recognize Bellin Health, Crest Inn, Breakthrough, which I think as of today was purchased by US Venture, Lord's Dental, US Venture, Northwest Wisconsin Technical College, Fox Communities Credit Union, Hospital Sisters Health System. Please give our sponsors a round of applause because they are So, this is Dr. Gene Eggers, and Dr. Eggers is one of the founding members of OHP. He was a pediatric dentist in town, never said no to a kid and a person in need. Just fantastic person. I consider him a friend and a mentor. Like other dentists in town, when he would get the call, please help this child, he would always say yes. And as Donna mentioned to me today when she came in, it was Dr. Eggers at a marketing meeting who said, "Hey Michael, read this book. This book's all about, what you guys do." And after reading it, I called Mary Otto up, found her number somewhere, and said, "Mary, will you come out and talk to us? We'll sponsor you and pay you and all that." She said, No, I'm doing it for free. I'll come out. But anyway, this is to honor Dr. Eggers because we miss him. Thank you. Okay, brief agenda. So we will do our speaker and panelist introductions. I'm going to tell you a little bit about the Oral Health Partnership, cover Wisconsin's oral health situation, just to make you all familiar with kind of where we are at as a state, and then really look at teeth and the national dental landscape. We have 7 questions for our panelists. Probably we could just say, hey, start talking, and it would be totally engaging, but we do have some questions for them. And then we'll open it up for discussion and questions from you all. After the event, too, we'll have some books out back and can do meet the author and book signing for people. So with that, if you would ready your microphones, make sure they're working and on. If you would each just introduce yourselves and maybe how long you've been involved in the dental world as well.
Hi, I'm Mary Otto, and I've been in the dental world for like 12 years now, but I don't provide care, but I'm honored to be here. I'm a journalist, and that's how I found out about the amazing, fascinating story of oral health in America. So anyway, great to be here. Live in Washington, D.C.
I'm Tim Kinzel. I'm a pediatric dentist in Madison, Wisconsin. I graduated from dental school in '84, my residency in '86. I've been practicing in Madison since then.
Russ Dunkel, I'm the state dental director, and I've even older than Tim. I started practice in 1981, did my residency there. I'm actually not a Marquette grad, so sorry about that. But I graduated from the University of Illinois Medical Center in Chicago, moved up here and did a residency, and decided to like Milwaukee. I know a lot better than Chicago, so decided to stay.
My name is Matt Crespin, and I'm the Associate Director at Children's Health Alliance of Wisconsin. I've been in dentistry for nearly 20 years. I graduated from dental hygiene school in 2002 and practiced for a short time, and have been at Children's Health Alliance for the past 13 and a half years, managing programs around the state, including one where we work closely with OHP on their school-based sealant program.
Thank you all, and I think probably others are thinking this. We are so lucky to have you all here tonight. Julie can tell you as the yeses came in from each of you, I was like, yes, they said yes, we got another good one. So we have a good panel. I'd like to tell you a little bit about Oral Health Partnership and who we are. So our mission is changing the lives of our community's children through access to excellent oral health services and education. We were founded when essentially school social workers came to Rotary and said, there's a huge problem. Kids are going to hospitals and they have bad dental issues and they're getting out of pain, but no one's able to treat the issue. There's so many kids that a few volunteer dentists can't help here. And so Rotarians, one of our other founders, Bob Bush, came together and said, how do we solve this? So dentists, business people said, let's come up with an efficient business model where we can live off of the Medicaid reimbursement and serve children. There are a number of different nonprofits throughout the state that are similar to us, that help children, help adults. Some people are in the room tonight. So I just thought it was worth noting that although some counties and in the Fox Valley have good programs, there are a lot of counties that still do not have dental health programs, whether for children or for adults. So to give you a sense. I want to show some of our growth. So in the past 10 years, you can see how many patients we served. This is pretty significant growth for us. We're now providing so many different procedures to children in need. I think it's somewhere between an average of 70 to 100 patients a day from some of the most at-risk families who get to their appointments and help their children get dental services. So, we couldn't do this without our team, our board, dentists. Shout out to Delta Dental of Wisconsin. I know you're in here somewhere. And how much you've supported us, the state, Dr. Dunkel, WDA, obviously Matt mentioned it, the Children's Health Alliance, and our donors and supporters. They really make this happen. It is a huge team effort. So, as for Wisconsin's oral health, to give you a sense, so we have had one of the lowest Medicaid reimbursement rates in the nation for many years. Most counties receive 27% reimbursement of usual and customary. So dentists are getting 90, 95, 100% reimbursement. Groups that serve children on Medicaid, adults on Medicaid are receiving around 27% reimbursement. Obviously, you can see less than, and it's a bit less than 1% of our overall Medicaid budget is spent on children's and adults Medicaid for dental, right? So very insignificant proportion. There are so many ER visits, so they're preventable, meaning they shouldn't be in the ER. They should have these issues taken care of before they ever get into the very costly ER. And a lot of counties, I've been told there are enough dentists. It's just a matter of the rural access and getting dentists where there is the need, right? So that's why you see some shortages. A typical dentist overhead, to kind of compare the 27% reimbursement, their overhead alone is 60%. So obviously it's hard for dentists to take children at that rate. And a lot of dentists I've talked to and in the room volunteer. They say, you know, we're just going to take this at a total loss rather than go through the Medicaid system. There's little adult Medicaid as well. So really, when we're talking about the 27% reimbursement, we're talking about kids. This graph, I think, is pretty instructive. I wanted you all to see it. So here we are, Wisconsin, dead last for children receiving a preventive dental service. So this was 2015. More recent data, access to dental care by children enrolled in Medicaid, we ranked 45th. Right now in the country. When I went to a national oral health conference recently, and probably some of you who are there can attest to this, I'd say, oh yes, and I'm from Wisconsin, and they'd go, oh man, that's so hard. You poor guy. So people understand kind of where we're at. To help change this situation a little bit, the WDA, others really lobbied for a pilot to say, hey, if we double the amount of reimbursement that you get, will that help make a difference? And so we went from 27, we're now at, it's roughly 47% reimbursement in these 4 counties. And with that, we were able to hire 2 new dentists, we opened a 3rd clinic, and we offered over 4,000 appointments to children, right? So we saw, yes, it's part of the solution. It makes a difference. And you can see some of the statistics here. Lots of dentists signed up. Right now, you should know that there are different proposals being considered in the state. There are a few different ideas on how to change this access issue, and I think our panelists will go into that tonight. So, I think that is enough for me, and I would like to turn it over. What we're going to do is start with Mary, and Mary, I would ask you just to discuss a bit about your background and the book, and then we'll get right into questions.
Okay. You just...
To you,
okay.
yes.
Thanks, Jim. Yeah, I got interested in this subject, it's 12 years ago now. I was working as a reporter at the Washington Post, and doing general assignment work, covering social issues, and I found myself at the bedside of a boy named Diamante Driver. He was 12 years old, he was at Children's Hospital, and it turned out he was dying of complications from an abscessed tooth. He'd come home from school with a bad headache, and his grandmother and his mother were, his grandma worked at a nursing home, his mom had different jobs. She took care of older people in their homes, things like that. They were a working poor family, a few miles from the U.S. Capitol, actually. And Diamante was normally a pretty active little kid, and his grandmother was so worried about him, she took him to this little community hospital nearby, and they diagnosed him with a sinus infection and an abscessed tooth, and he got some medicine, and they just kind of went back to their lives. He went back to school, and he got much sicker. A couple days later, his mother was alarmed, took him to a county hospital, Prince George's County, and that's where he was diagnosed with meningitis. This infection had spread to his brain, from his tooth. He was rushed to Children's Hospital in Washington, where he got 2 brain surgeries, and when I met him and his mom, he'd been in the hospital a couple of weeks, and it looked like he was slowly recovering. It was like I wrote a story about the shortage of care for Medicaid kids in Maryland. His mom had actually been trying to find a dentist for his younger brother when Diamante got sick, and they had a list of dentists who were supposed to be participating in the Medicaid program there in Maryland, like I said, a few miles from the U.S. Capitol, and there was nobody on that list who would take Deshaun, Diamante's younger brother, and Diamante and Deshaun had gone without care for, regular care for a while. The rate, it turned out, was fewer than a third, of Medicaid children were getting routine care in the state, and the reimbursement rates were among the lowest in the country. So I wrote this story. It turned out Virginia and DC weren't doing much better. I looked at the whole region, and I talked to the head of the dental association. He said, our system is just broken. We're not helping there's not enough people to help these kids. It's just a mess. And I got the story turned in to my editor, and it sat on her desk for a few days, and I stayed in touch with Mrs. Driver, Diamante's mom, and he seemed to be making slow progress. He's moved to a rehabilitation hospital to relearn how to do basic skills, and his teachers were bringing him his math homework and stuff from school. Finally, I get a call from my editor. She said, we're going to run that dental story tomorrow. And I said, okay, well, let me check with Mrs. Driver to make sure Diamante's still, making progress. And he had died. He died over the weekend. The infection took him finally. So, of course, I had to rewrite part of that story. After the story ran, there were congressional hearings held about the problems. It wasn't just a problem in Maryland or in our region, it was a national problem. And Kathy Roth came from Wisconsin to testify about the problems Wisconsin was having with reimbursement rates and participation, and the shortages of dentists in poor communities, and and Congress asked for a stricter supervision of state programs and more accountability. And in Maryland, a big reform movement was launched. They raised the reimbursement rates for dentists. They streamlined the bureaucratic system that dentists and patients had to, try to navigate to try to make it easier. And they allowed dental hygienists to start doing sealants in schools. That was something they've been wanting to do for a long time. And they put into place a reimbursement program so physicians and nurses could get reimbursed for doing well baby checkups. When they see little kids for their first shots and all that, just look inside their mouths. Do a fluoride varnish if they have a tooth, Teach the parents about good sleeping habits and keeping the baby's mouth clean. Basic stuff. But Maryland likes to say they've gone from worst to first. Now they're up above half of the kids. They're doing pretty well, and more dentists are participating. But to make a long story short, I got hooked on the story, and I kept writing and writing and writing, and I ended up writing a book, so.
Glad you did. So glad you did. Thank you, Mary.
Sorry to make a long story.
No, it's important, and a lot of people reference that. So, we've prepared 7 questions for the panel. We tried to leave them broad enough so that everyone can understand, in case you're not always in the dental field. And so after these 7 questions, which feel free to answer or not based on them, we won't say, wait, you didn't answer that, we're coming back to it. But then at the end, there will be an opportunity for everyone to ask questions, because some of you even called me before this and said, what about this, Michael? I want to hear about this. So question number 1, what are key issues that impact the dental health of adults and children who are underinsured or uninsured? And when I say underinsured, that typically means Medicaid, right? They don't have private dental insurance. So you all know, by way of contrast, Wisconsin ranks somewhere around number 1 for people with private insurance for our dental health outcomes. We are ranked the best if you have private insurance. We are among the worst if you have Medicaid or you are uninsured.
I was teasing Mike a little bit earlier today because I understand how politicians do this now. When they are asked a question, but they answer to another question, because these are all hard questions, and so hopefully I won't do that too much. But Obviously, the key issues is access. If you don't have access to dental care, that's going to affect your dental health. In the population that typically, historically, doesn't have access, they have a higher incidence of dental pathology. And so the people that need the care the most don't have a way to get the care. And it's a compounding problem. And along with this, this is my non-answer to your question, is that we also as a group have to decide what our success is going to be. I talked about that this morning. We haven't really defined what does it mean to solve the access problem. Everybody has a different idea what that means. It could be that everybody gets sealants. It could mean that everybody has a dental home. My feeling is it more as, well, if you have medical assistance or you don't have insurance and you have a toothache and you call somebody, it takes you 1 or 2 phone calls and you're into the dentist within a day or two within a reasonable amount of distance that you travel. I think that alone would solve a lot of our problems. But we as a group have to determine what our success will look like. And I don't think we've got that yet.
Yeah, I would agree with you, Tim. And access has many sites or many viewpoints. It's not just, is there a dentist, it's can I get there? And I know as a private practitioner, I was in clinical dentistry for 37, 38 years, and one of the issues has always been with Medicaid is the no-show rate. Well, there's a lot of factors that are involved with the no-show rate. It may not be that they don't, one of it may be health literacy, they don't understand or don't value it, but other issues may be transportation. If they live in a city that doesn't have public transportation, they don't have an automobile, how do they get to an appointment that's 15 or 20 miles away and they've got 3 or 4 kids they've also got to worry about and who's going to watch them? So there's other factors in the accessibility issue along the lines of social determinants of health. And those are other factors we have to look at besides just, are there enough dentists? There's other factors that we really have to take into consideration.
Yeah, I think I would just add, I agree with both of you, and I think, access is a big issue. I think, Dr. Dunkel, you started to kind of hit on where I was going, which is this understanding of the importance of oral health. There might be some of you in this room that didn't realize that you could actually die from preventable dental access, the story that Mary just told you. I think in general people don't realize the connection between the mouth and the body, and I think we don't do ourselves a lot of justice when you think about the way we promote oral health in general. When you watch TV and you see commercials about dental things, it's about having white, clean, straight teeth, not about having healthy teeth that's preventing heart disease or many other issues that we deal with. So I think there's an educational component that goes along with that to helping emphasize the importance of good oral health at a really, really early age, and I think that helps play into success down the road.
Great, thank you very much. Question number 2. How can we achieve an American healthcare system, and this is from the book, that meets the oral health needs of all Americans and integrates oral health effectively into overall health? Mary, you did a great job in your book detailing how dental and medical have been separate from the beginning of the dental kind of practice. And so, yeah, the question is, how might we achieve a better American healthcare system that meets some of the oral health needs?
That was from Dr. David Satcher, Oral Health in America, his landmark 2000 report. He was the Surgeon General at that time, and it was like the first national look at our oral health, in all these years, And he wasn't a dentist, he was a physician, and he recognized that our system was fragmented, and it doesn't really reflect our bodies. Our healthcare system treats oral health and dental care separately from general health, and yet, of course, as you've all said, it's our overall health and depends on oral health. And so to fix the system is to make it reflect our health better. So patients don't have to navigate to a foreign system to take care of their oral health and get lost in the translation a lot of times. As I worked on the book, I learned that roughly 1/3 of Americans experience significant barriers just getting access to our dental system, which is separate.
one thing is that we can do a better job of educating our medical compatriots as far as how important dental is, and just have them look in the mouth when they work and checking on kids, and making them part of the solution as much as possible, and take advantage of their expertise and knowledge. And they have more access to the kids than we do. The kids go to their pediatrician more than they go to the dentist. As a practicing dentist, we've been told many times that we need to be more like medicine, and to make the practice of dentistry part of the practice of medicine scares the hell out of us. Because we see that as a very inefficient system that has blossomed into an unwieldy behemoth. And in dentistry, we do not have the financial production to make us profitable in the medical system. And the only way we can be viable is to be on our own and independent. And Dr. Stoll is looking at me, and I hope he's nodding his head yes. So there's two parts of this. One is the care and how influential dental health is on overall health, but also on the practice of dentistry, because we could get sucked up and be less effective.
So I think you're starting to see a lot more push around the integration of oral health into medicine. Recently in the state of Wisconsin, the statutes changed around how dental hygienists can practice, and now allows dental hygienists to practice in medical settings. So as Dr. Kinzel said, a child between the ages of 6 and 5 years old will probably visit their pediatrician at least 10 times for just well child visits. And it's such a huge window of opportunity to provide preventive dental services, whether it's education or fluoride varnish, to patients when they're already where they're in a situation where they're already there, they're right in front of you. Physicians can apply fluoride varnish now, but what we know is that in Wisconsin, there's about 100,000 kids ages 0 to 5 that are enrolled in Medicaid that have a physician visit every year and do not have a dental encounter. So those are kids that are already accessing the system. About 90% of kids see their doctor every year. Why not provide care where families are? So I think OHP does a great job of this, of taking care out to families, to whether it's kids or adults in mobile type settings. I think we have to think a little bit differently about how we provide that care and where we provide that care.
I mean, Tim makes a good point exactly, that the medical model and the dental model practice differently. But one of the things we've got to figure out is how to break from our silo and work back and forth with our medical components or our medical colleagues. And I have to say, years ago, and this goes back to the late 80s and early 90s, the cardiothoracic surgeons got it. I mean, I was literally getting a call every week from a cardiothoracic surgeon to go in the hospital and do a case before they would do a valve replacement or heart transplant. So the oral systemic link, they got. And I'm seeing more and more physicians that I'm talking to, both at the state level and colleagues that I've worked with, they do get it. They understand that, okay, it's an integrated system. We have to stop looking at these individual silos. We have to work together. And I think that's the important thing, is we've got to figure out how to work together to get this. Because it's not just oral health, it's total health.
Thank you. Mary, you brought up the 2000 Surgeon General's report, and in that, the Surgeon General referred to the dental issues as the leading silent epidemic affecting our communities. People, children and adults with untreated decay and severe dental pain. Here, I'm getting out of my depth here. Streptococcus mutans is the leading disease in the U.S. and with children. It's a disease that's transferred to people. That's what decay is, essentially. So it disproportionately affects people of color, people on Medicaid, and from the book, Medicaid serves people who are in crisis and people who are poor and who would otherwise lack access to care. If you would please discuss Medicaid in Wisconsin and the nation.
In the nation, there's 70 million Medicaid beneficiaries. It's like 1 in 5 Americans, so it's not just a little piece of the puzzle, it's a significant piece.
You know, I think it's important to realize too that the benefits under Medicaid vary from state to state. The states determine what they're going to cover and what they're not going to cover, with some general framework from the feds about children, but they can decide to cover adults or not. And I believe that this is a true statement that Medicaid was for people in crisis, but for a lot of our families, it's become their health care. I've been in practice long enough, I'm on the third generation, and everybody's been on Medicaid. So that's where they access the system, and that's why the lack of access is so glaring.
And that's a good point. Actually, in the United States, Medicaid is now the largest insurer in the nation. They insure 1/4 of the population, not only in Wisconsin, but nationally. So they are the #1 insurer in the country. And unfortunately, the people are not getting care. You know, it's a serious issue when you figure that many people are having problems getting care. And just on an aside, not even speaking dental, for the state of Wisconsin, most people probably don't know, but the African American infant mortality rate is the highest in Wisconsin. It's higher in Wisconsin than any state in the nation. And without a healthcare system in this state, that to me is pathetic, that we're seeing that many children die and not getting access to care.
So, just to kind of talk a little bit about Medicaid here specifically in Wisconsin, I think, you've heard from multiple people here on this panel that addressing dental disease is really multifaceted, and I think with Medicaid it's also very multifaceted. I think the reason that patients that are enrolled in Medicaid have a difficult time accessing care is, as you heard, reimbursement rates in Wisconsin are one of the worst in the country. We have tried this pilot project in 4 counties, and Brown County specifically has seen some tremendous increase, primarily probably due in part to a lot of the work that you guys at OHP do. And I think, there's some proposals being circulated right now. Part of the governor's budget includes a $43 million proposal to specifically address dental care in our state, and $39 million of that $43 million is called out to specifically increase Medicaid reimbursement rates across the board for both children and adults in all counties, and it would specifically incentivize providers that provide a disproportionate share of care. So an example I could give you is if you're a nonprofit entity and you provide care to 50% of your patients are uninsured or Medicaid insured, you would get an increase in your Medicaid reimbursement rate versus a provider that might not provide that threshold of care. So the governor is looking at this and has made this proposal as part of his state budget. That's the biggest component of the $43 million. There's also funding in there to support the state oral health program staff. There's funding to expand the school-based dental sealant program. There's funding to create dental therapists, which are a mid-level dental provider that exists now in multiple states around the country, including next door in Minnesota, and to fund the dental therapy education training program where these potential students would be trained. I think what's important about all of this is that Governor Evers' proposal, this $43 million, along with the multiple other proposals you've seen roll out in the news over the past several months, they hinge squarely on one thing, which is the state agreeing to take Medicaid expansion. And by taking Medicaid expansion, it would increase federal dollars into Wisconsin by about $1.6 billion, and it would total the Medicaid budget for dental, it would increase us to a surplus of $2.4 billion total with what Wisconsin puts in and what the feds put in. So this really great proposal of investing $43 million more into dental hinges on the legislature expanding Medicaid, which would enroll close to 90,000 more enrollees into Medicaid, and increase pay to dental providers for Medicaid services. Probably not to a rate that's sufficient, but it's better than where it is right now. I can certainly agree that I think increasing Medicaid rates even more significantly would be great, like they are in the pilot, but this would be really an across-the-board increase for both adults and kids.
Thank you for laying that out too, Matt. Go ahead.
Yeah, and just a point as far as when we're looking at the numbers. Last year, Medicaid spent over $10 billion. Dental portion was $117 million. So you can kind of figure from a math standpoint why the rates are so low.
saw you reaching for the mic.
For those of us that have been working on the legislative side of this for a long time, it's nice that we have a politician who's finally actually making a specific proposal. I can't tell you how many times over the last 30 years, how many different legislators or governors said, oh yeah, we got to do something for you dentists. But nothing ever happened. We never had a champion for the cause. And that can be a little frustrating to those that are getting gray hair and have been doing it for so long. But at least we got a specific proposal. And while there's a lot of points in there that can be debated, what's successful or not successful, I think at least we're talking about it, and at least there's some money on the table, which is better than nothing.